Okay, so today we're going deep on something I think we all can relate to, navigating the hospital, right?
Yeah, hospitals.
It can be a really tricky place, especially if maybe English isn't your first language or if you're studying for the IELTS.
Yeah, that's right.
So we've got a super helpful resource that was actually put together for folks in those exact situations.
Mm-hmm.
And it is packed with vocabulary phrases, really practical stuff to make you feel way more comfortable and confident.
And in control, really.
Absolutely in those medical environments.
So we're going to take all that great stuff, we're going to break it down, make it super clear.
Right, to the point.
So you walk away feeling like you can handle anything a hospital throws at you.
You know what I love about this resource is that it really does cover everything from the get-go.
Oh, it's comprehensive.
It's like, okay, you need to know the basics, right? Patient, doctor, nurse, ER.
Exactly.
Then it goes deeper. Like,
Yeah.
okay, how do you even make an appointment? What's a prescription? What is medication? How do I talk about what I'm feeling? My symptoms.
Yeah.
Getting a diagnosis.
And then even further, like, how do I ask for help? How do I make sure I understand what the doctors and nurses are telling me about my treatment, my recovery? And then, oh my gosh, the medical tests.
All the jargon that comes with it.
And then, of course, let's not forget insurance.
The dreaded.
Right. Nobody wants to deal with that.
Absolutely.
So we're going to really unpack all of that. And our goal today is to take all this potentially overwhelming information
Yeah.
and boil it down,
Distill it.
to the most essential stuff.
Exactly.
So you walk away with those phrases you need and a much clearer sense of how to actually communicate effectively in a hospital setting.
I think what's so fascinating about this resource is how it really anticipates all the different scenarios you might encounter.
Yeah.
It's not just about knowing the words, it's about understanding how to use them.
Yeah, in context.
In real conversations to get the help you need.
Absolutely. Okay, so let's build that foundation first.
Okay.
The essentials, right.
The vocabulary starting with patient. Now, this one's pretty straightforward.
Straightforward.
It's the person who's receiving the medical care.
Hmm.
So you'll probably hear this word used a lot by staff members, like, the patient in room 101 needs assistance.
Exactly.
Okay, simple enough.
That's simple.
Then we've got doctor.
Mm-hmm. The all important.
Right, the healthcare professional who figures out what's wrong with you and how to treat it. Now, the resource makes a really helpful distinction between a general practitioner,
Your GP.
your GP, right?
Yeah.
Who you would typically see for all sorts of general things, versus a specialist, like a cardiologist for your heart or a dermatologist for your skin. So if you were to say, I need to see a specialist for my back pain, that really gets across what kind of expertise you're looking for.
And that's key, understanding the difference between a GP and a specialist, because it can really impact, the course of your care. Sometimes you can go directly to a specialist. Other times you need a referral from your GP.
Yeah.
It can save you time and, get you to the right doctor more efficiently.
Exactly. Then we have the nurse.
Yeah, the ones who are with you often, more so than the doctor.
The front line.
Yeah, they're the ones who assist the doctors, monitor your condition.
Yeah.
They're the ones giving you your medication, making sure you're comfortable.
Our caregivers.
Yeah, and helping you with your daily needs while you're there.
So a good phrase to have in your back pocket is, could you please ask the nurse to check on me?
Super useful.
Super helpful. Okay, then we have the emergency room.
Ah, yes, the ER.
The ER. This is for when things are serious.
Yeah.
It's urgent. It's accidents, severe injuries. You suddenly get really, really sick.
Yeah, when it's critical.
Right. The patient needs to go to the ER immediately.
Or, I need to go to the ER. It's an emergency.
Right, no time to waste.
Exactly. And it's important to understand what warrants a trip to the ER, because sometimes, you could go to an urgent care clinic or even just see your GP for things that aren't, life-threatening.
That's true. That's true.
Yeah.
Okay, let's talk about appointments and consultations.
Okay.
Now, an appointment is a set time to see the doctor or a nurse. Usually you book these in advance.
Hmm.
You'll probably get a confirmation like, your appointment is confirmed for 10:30 a.m. tomorrow.
Right.
Now, consultation often means the same thing as an appointment,
Hmm.
especially when you're meeting with the doctor to discuss your health issue or your treatment plan. So a simple phrase like, I'd like to make an appointment with the doctor for next week gets the job done.
Yeah, and, I think it's really important to remember to be proactive about scheduling your appointments.
Yeah.
Especially for routine checkups or non-urgent things, because that can help you stay on top of your health and often avoid those, bigger issues later on.
It's preventative.
Exactly.
All right, so let's talk about what happens after you've seen the doctor.
Oh.
You might get a prescription, which is basically the doctor's written order for a specific medication or treatment.
Yeah.
It tells the pharmacist what to give you the dosage, how often you should take it.
So you might hear, the doctor gave me a prescription for antibiotics.
Right.
Now, medication, that's the actual medicine itself.
The pill, the liquid.
Right. Could be pills, could be liquid injections, you name it. A nurse might say, the nurse will administer your medication shortly. Or you might say, I've been prescribed some painkillers.
And it's so important to fully understand your prescription.
Yeah.
You know what I mean? Make sure you know the name of the medication, the dosage, how to take it, and when. Don't be afraid to ask your doctor or your pharmacist to explain anything you're unsure about.
Absolutely.
Yeah.
Okay, then we have symptoms.
Right.
These are the signs that something's not quite right.
Yeah.
They can be physical, like a cough or a fever, or they can be emotional, even like if you're feeling really anxious or unusually tired.
Yeah.
Describing your symptoms accurately is super important for the doctor to figure out what's going on.
Exactly.
So some examples that the resource gives are really helpful, like I have a headache and I feel dizzy, or I have been coughing for 3 days and have a sore throat.
The more specific you can be about what you're experiencing and when it started, the better.
Absolutely.
Yeah.
And also think about, when the symptoms started, how often they occur.
Yeah.
If anything seems to make them better or worse, all those details can help your doctor pinpoint what's going on.
They're like clues.
Exactly.
Okay, so that leads us to diagnosis. This is what the doctor determines is causing your symptoms.
Right, based on everything they've gathered.
Based on your symptoms, any tests that they've run, and their examination.
Yeah.
You might hear, the doctor has diagnosed me with the flu, or if they're not sure yet, they're still trying to figure out the diagnosis. Okay, then there's treatment.
The plan of action.
Right. The plan of action to address whatever the diagnosis is.
Exactly.
This could be medication therapy, surgery.
Lifestyle changes.
Yeah, all sorts of things. So you might hear, my treatment plan includes a course of antibiotics and bed rest, or I need to follow up with the doctor to see how the treatment is working.
So basically, having a good grasp of this basic vocabulary is your first step towards navigating the healthcare system successfully. It really enables you to understand what's being said to you and to communicate your own needs and concerns clearly.
It's like a foundation.
Exactly.
Okay, so let's get into some key phrases for those common situations you'll probably find yourself in.
Okay.
Starting with making appointments.
Right.
Now, the resource highlights this phrase, which is great because it's direct and clear. I need to make an appointment with the doctor. You could say, for example, I need to make an appointment with Dr. Smith for my annual checkup.
Yeah.
Now, what if you're feeling sick and need to see someone soon?
Yeah. Then you might say, I'm not feeling well. I need to see a doctor.
Right.
And you can even amp up the urgency if you need to. I'm feeling really sick. Can I see the doctor today? Because sometimes you need to be seen right away.
You do. Now, let's talk about those key terms. We just went over medications, symptoms, diagnosis, treatment. The resource gives us some really handy phrases for using those words in real conversations. So if you've already got a prescription, you can tell the pharmacist, I have a prescription from the doctor. For example, I have a prescription from Dr. Johnson for antibiotics.
Simple and straightforward.
Easy peasy.
Exactly.
Now, to understand what's going on with your health, you can ask, what's the diagnosis?
Right.
Or you could say, the doctor mentioned a possible infection, but what exactly is the diagnosis?
And it's super important to feel comfortable asking for clarification
Oh, absolutely.
about your diagnosis.
Yeah.
If the doctor uses medical jargon, you don't hesitate to ask them to break it down for you.
Yeah, make them explain it in plain English.
Absolutely.
Hmm.
Because you need to understand what's going on to participate in your own care.
Exactly. Okay, so once you've got a diagnosis, it's good to know what to expect. So you can ask, can you tell me the symptoms I should look out for?
Mm-hmm.
So you can kind of monitor things. You could even say, the doctor said I might have a reaction to the medication. What specific symptoms should I watch out for that would indicate a problem?
Yeah, being prepared.
Absolutely.
And then thinking about recovery, I think a natural question is, how long will it take for me to recover?
Right.
Like if you've had a procedure done, you might ask, I had a minor surgery on my hand. How long should it take to feel completely normal again?
Right.
And always good to clarify about follow-up. Do I need any follow-up appointments? You could say, I had my stitches removed today. Do I need to schedule a follow-up to make sure the wound is healing properly?
I like that because it shows that you're really engaged in your recovery.
Yes, you're taking an active role.
Yeah, you want to be informed every step of the way.
Exactly. And part of that active role is asking, is there anything I can do to speed up recovery?
Yeah.
Especially after an illness or an injury. And another super important question, especially when you're starting a new medication, are there any side effects I should know about? You could say, the doctor prescribed this new pain reliever. Are there any common side effects I should be aware of?
Right, because medication can have side effects.
Absolutely.
And being informed can help you manage those. Yeah, and let's not forget the practical stuff. How much will this treatment cost? If the doctor recommends an x-ray, you might want to ask, can you give me a rough estimate of how much the x-ray will cost?
Yeah, because medical bills can be scary.
They can be.
It's always good to ask about costs up front.
Okay, let's switch gears for a minute and talk about actually getting around in the hospital.
Oh.
Because hospitals, they can be huge.
So many corridors, so many departments.
Right, and confusing. Knowing how to ask for directions is key.
Absolutely.
So the most basic phrase is, can you tell me where the emergency room is?
Yeah.
And if it's a real emergency, you can add some urgency to it. Excuse me, can you tell me where the emergency room is? I need help right away. Now, another key spot you'll probably need to find is the registration desk.
Yeah.
So knowing how to ask, where can I find the registration desk, is super useful.
And the registration desk is usually your first point of contact when you arrive at the hospital.
Right.
It's where you provide your information, get checked in.
Yeah. If you need to go to a specific department for a test or a procedure like an x-ray, you'll need to ask, how do I get to the x-ray department? Or if you need to pick up a prescription after your appointment, knowing how to say, I'm looking for the pharmacy, could you point me in the right direction, is really helpful.
Nearby.
Is there a waiting area nearby where I can sit down while I wait for my appointment?
Perfect.
And then, of course, the universal question.
That we all need to know.
The all-important, where is the nearest restroom?
Exactly.
But sometimes you need more than just basic directions.
Right.
You might need clarification or more detailed assistance. So here are some slightly more advanced requests.
Okay.
If you didn't quite understand something the doctor or nurse said, a polite way to ask them to repeat it is, could you please explain that again? I didn't quite understand. Or simply, I'm sorry I don't understand. Could you repeat that?
Yeah. And, if there's a language barrier, don't be afraid to ask for a translator.
Right?
You can say, is there someone who speaks your language who could help me? Because many hospitals have translation services available.
Yes, they do. And it's really important to overcome any communication barriers.
Oh, absolutely.
because you need to be able to understand that medical information and make informed decisions about your own care.
Exactly.
Now, if you want to learn more about the different ways your condition could be treated, a good question is, where can I get more information about my treatment options? I'd like to learn more about what to expect.
Right.
And if you're totally lost in the hospital, which can happen,
Easy to get turned around.
don't be afraid to ask, can you show me on the map where I need to go? Especially in those bigger hospitals.
Yeah, they can be like labyrinths.
They really can. And if you're stuck waiting for a long time, it's okay to politely ask, how long will I need to wait to see the doctor? Or how much longer do I have to wait?
Yeah, I think managing your expectations around waiting times can really reduce anxiety.
Yeah.
Asking for an estimated wait time can make the experience a little less stressful.
Absolutely. The resource also gives some good general tips for feeling more confident in the hospital.
Okay, what are they?
Be polite and respectful to the staff.
Of course.
Keep your important documents organized and easy to find. And probably most importantly, don't hesitate to ask for help.
Ask away.
When you need it. And honestly, I think that's good advice for any unfamiliar situation, right?
Absolutely. Hospital staff are there to help you. They understand that hospitals can be confusing, and they would much rather you ask a question than feel lost or misunderstand something important.
Absolutely. Now let's talk about communicating with the doctors and nurses, specifically when you need to describe your symptoms.
Okay.
This is so important for getting the right diagnosis and treatment.
Yeah, crucial.
A good way to start is by giving a timeline and being specific about what you've been feeling. So you might say something like, I've been feeling under the weather for the past few days, and I've developed a cough, and I'm feeling really tired. Adding those specifics and the time frame really helps them get a clearer picture.
It does. It gives them context.
And if your symptoms are localized, in a specific area, be precise. I have a throbbing headache right behind my eyes, and I feel nauseous, especially after I eat.
Yeah.
Mentioning triggers like that can be really helpful too.
It helps them narrow down the possibilities.
For fevers, if you've been taking your temperature, make sure to share that information. I've had a fever for the last 24 hours, and it's been around 101 degrees Fahrenheit.
Right.
And if you have any allergies...
This is critical.
Oh, this is so important. I'm allergic to penicillin. Are there any other antibiotic options I could take?
Yeah, you don't want to have a reaction.
Definitely. Describing the frequency and impact of your symptoms is also really helpful. For example, I've been coughing a lot, especially at night, and it's been keeping me awake.
Right.
And when you're describing pain, be as precise as you can about the location, the intensity, and what makes it better or worse. I feel a sharp pain in my chest when I take a deep breath, and it gets worse when I cough.
Yeah, all those details matter.
All those details matter.
It's like putting together a puzzle for the medical team.
Yes.
The more information you give them, the easier it is for them to figure out what's going on.
They're like detectives.
Yes. Wait.
Okay, now what about asking those more in-depth questions about your treatment recovery diagnosis and any tests?
Okay.
A good way to start is, could you explain the different treatment options for my condition? What would you recommend as the best course of action in my case? Then a natural follow-up is, how long should I expect to take to fully recover from this?
Yeah.
And it's always smart to ask about potential issues. What are the possible side effects I might experience from this medication or treatment? Are there any specific risks I should be aware of?
Absolutely. And, asking those kinds of questions really shows that you're taking an active role in your health care.
Yeah.
You're informed, you're participating in the decisions.
You're part of the team.
Exactly.
When you're given a prescription, make sure you fully understand how and when to take it. So ask, how often do I need to take this medication? And should I take it with food or on an empty stomach? And it's good to know if it will affect your daily life. Can I continue with my normal activities while I'm taking this medication? Are there any specific things I should avoid doing?
Especially if you're, driving or operating machinery.
Exactly. And for those long-term conditions like high blood pressure or diabetes, you might ask, are there any lifestyle changes like diet or exercise that I should make to help manage my condition?
Right. Taking ownership of your health.
Now, moving on to understanding your diagnosis and any tests you can ask, what exactly is the cause of my condition? Is it something I could have prevented?
Mm-hmm.
And if they're recommending tests, you can ask, do I need any specific tests to confirm the diagnosis?
Right.
Of course, you'll want to know about follow-up. So ask, are there any follow-up appointments I need to schedule to check on my progress? And lastly, don't be afraid to express any concerns you have. Is there anything in particular I should be concerned about regarding my condition? Are there any warning signs or symptoms I should watch out for?
I think that asking those questions really helps you feel less anxious about the unknown.
Yeah, you're more in control.
Exactly.
Now let's delve into some of the common medical procedures and tests you might encounter.
Oh, yeah.
The resource explains these in a really helpful way. Starting with the X-ray,
Right.
uses radiation to create images of the inside of your body. You might hear something like, I need to get an X-ray of my arm, or I had an X-ray done to check for a broken bone.
Pretty common.
Very common. Then there's the blood test,
Yeah.
where they take a sample of your blood to analyze it for all sorts of conditions.
Mm-hmm.
You might say, I'm going to need some blood tests to figure out what's wrong, or I had a blood test yesterday to check my cholesterol.
Right. And those are kind of the building blocks of diagnosis.
They're the basics.
Exactly.
Now we have the MRI.
The MRI.
Magnetic resonance imaging.
Yeah.
Uses powerful magnets and radio waves to create very detailed images of your organs and tissues.
Really good for looking at soft tissues like your brain, your spine, your joints.
Yeah, you might hear, the doctor recommended an MRI to get a better look at the problem, or I need an MRI of my knee to check for ligament damage.
Right.
Now, ultrasound is another imaging technique, but this one uses sound waves to create real-time images, often used during pregnancy, or to examine organs. You might hear, I'm going to have an ultrasound to check on the baby, or the doctor ordered an ultrasound to look at my liver.
And it's fascinating how each of these different imaging techniques provides different information.
Yeah.
So doctors can get a really comprehensive picture of your health.
They each have their specialty.
Exactly.
Now, then we have surgery, which involves making an incision in the body to treat or remove something. You might hear, I've been scheduled for surgery next week, or the doctor recommended surgery as the best way to treat this. And then there's anesthesia, the medication to prevent pain or to make you unconscious during procedures.
Right.
A common question is, will I be put to sleep during the procedure? Or you might hear, the surgeon will administer local anesthesia before we begin.
And, I think understanding the type of anesthesia being used can really help with anxiety.
Absolutely. Now, the resource also provides some really important questions to ask about any procedure or test.
Okay.
So always a good idea to start with, what exactly will this procedure involve and how long will it take? It's also crucial to understand any potential downsides. Are there any risks or side effects associated with this procedure?
Right. Safety first.
Absolutely. If you need to do anything to prepare, ask, how should I prepare for the name of test or procedure? And to understand the timeline for results, ask, how long will it take to get the results from my name of test?
Yeah.
Don't forget to ask about what comes after. Will I need any follow-up appointments after the procedure? And is there anything specific I should watch for after the procedure? And if you have concerns or reservations, it's okay to ask, what are my options if I decide not to go through with the procedure at this time?
I think asking those questions really empowers you to be in control of your healthcare decisions.
Absolutely.
You understand what's happening. You can advocate for yourself.
Okay, last but certainly not least, let's tackle health insurance and medical costs.
Oh, boy.
I know, right?
That's everyone's favorite topic.
But understanding this can really help avoid surprises and reduce stress. So when it comes to insurance coverage, a key question is, does my insurance plan cover this particular procedure? I need to get an MRI scan.
Mm-hmm.
Now, you might also want to get a broader understanding of your benefits. Could you please explain my insurance coverage to me? I'm not entirely sure what's covered under my plan.
Right.
And for those bigger procedures, it's really important to know, do I need to get pre-authorization from my insurance company before this surgery?
Yeah, because you don't want to get stuck with a huge bill.
No, you don't. And to understand your potential out-of-pocket costs, you can ask, how much will my insurance cover for this treatment? I'm going to need physical therapy.
Yeah, insurance can be really confusing.
They can be.
So don't be afraid to ask for clarification from both the hospital and your insurance company.
Yeah, make sure you're on the same page. Now, when it comes to the actual costs, a good rule of thumb is to ask up front.
Yeah, transparency is key.
So for a specialist visit, you might ask, what is the estimated cost for a consultation with the cardiologist? For a more involved procedure, what is the estimated cost for the knee surgery, including anesthesia and any facility fees?
Yeah.
And if you want a detailed breakdown, ask, could I please get an itemized bill for my recent hospital visit and all the tests?
And reviewing an itemized bill can sometimes help you catch any billing errors.
That's true. Now, what if you don't have insurance?
Yeah. What are your options then?
Well, you can ask, I don't have health insurance and I need this procedure. What are the payment options or financial assistance programs available?
Mm-hmm.
It's also worth asking about discounts. Is there a discount if I pay in cash?
Yeah, sometimes there is.
And to clarify the payment timeline, ask, do I need to pay for the consultation up front or can I be billed later?
Yeah.
Finally, to understand the big picture, ask, could you give me an estimated total cost for my treatment, including follow-ups and medications? And if you get a bill that you don't understand, don't be shy about asking for help. Could someone please explain this bill and the charges?
Yeah, don't be afraid to ask for clarification.
Absolutely. Being proactive about the financial side of things can really save you headaches later on.
Definitely. Okay, so to wrap this all up,
Yeah,
we've covered a lot today.
we have.
But the goal was to really equip you with those essential vocabulary, like words and phrases,
Yeah.
to navigate all those different situations you might find yourself in at a hospital.
Right, from understanding those basic medical terms to knowing how to schedule an appointment, describe your symptoms, ask those important questions about your diagnosis and treatment, find your way around, understand those sometimes scary medical procedures,
Absolutely.
and even demystify that confusing world of health insurance and medical costs.
Yeah, and it's all about giving you the tools to approach healthcare confidently and understand what's happening.
Yeah,
So you can have a more positive and less stressful experience.
it's all about being empowered.
Exactly.
So here's a final thought for you all to ponder.
Okay.
Think about how being able to communicate clearly and confidently in a healthcare setting,
Mm-hmm.
it doesn't just affect you individually.
Right.
It can ripple outwards.
It can impact the whole system.
So how could widespread health literacy and the confidence to ask questions,
Yeah.
how could that contribute to a more transparent, more equitable, and truly patient-centered healthcare system for everyone?
Food for thought.
It is. What other questions or areas of exploration does this spark for you about the vital role that clear communication plays in our health and well-being?
It's a big topic,
It really is.
but I think it's one worth exploring.
Absolutely. Okay, well, that is our deep dive on navigating the hospital.
Thanks for joining us.
Yeah, thanks for listening. We'll catch you next time.
See you then.
Bye.